come in. Hi there, alright. Yeah, I'm great, thank you. Yeah, my name's Dr. Terence. Yeah, great, please sit down. Make yourself comfortable. Can I just ask for your surname, please, just so I can find you on the system? Great, thank you. It won't be a moment. So did you get here okay? Was there not any problems? No, that's good. I've been having some issues getting in, you know, due to the road closing just outside the surgery. And yeah, it's quite a pain to get through in the morning, but it's not going to stay there for long. Not much longer anyway. So, okay, right, so I've got you here for 12:30, yeah, sorry. Okay, so I'm just going to ask you now, do you know why your doctor sent you over to me today? Oh right, okay. Yeah, it is an examination, but it's not anything painful, or it's not going to be complicated for you anyway. It's called a cranial nerve examination, and basically what that is, it's just testing your senses and seeing your responses to that, how quickly, you know, just an overall look at you, seeing how your general senses are. Alright? So it's not going to be, like I said, it's not going to be painful or complicated. All you have to do is just relax, and I'm going to do basically all the work. Yeah, that's what I'm paid for, so. So it says here that your doctor wants you to have a test on your sight and your sense of touch. Yeah, is that right? Yeah. So did you have any problems with these senses then recently, or? You did, right, okay. Yeah, do you wear glasses at all? You don't, right. Well, that's probably one reason why you might be having some problems with your eyes, because, you know, as you age, I suppose, I don't really like to use that word, but I guess as you progress through life, there's some things in your body starts to sort of slow down a little bit, weaken, and so your eyes is unfortunately one of them. So it's very, very vital that you do get them checked out at an optician's, and if they feel you need prescription lenses, then it would be best to take their advice. Okay. But worry not, because we're going to do that anyway today. A little eye test. So I'm just going to confirm that so I can write the report to your doctor. And what's the issue with your sense of touch? Okay, so, right, so around the cheek area of your face. Okay, may I ask how that happened? Did you... Oh, right, okay. Yeah, if you do have very bad burns, you know, on your face, it's going to take away your feeling on your skin for a good amount of time. So how long ago was that incident? About 4 months. Okay, so it should begin to regenerate your cheek areas. How did you burn them, if I may ask? Oh, alright, I see. Yeah, you should be very careful. You know, ovens are very hot, so I hope you've learned your lesson about that. Yeah, it doesn't look, let's have a quick look at you. It doesn't look that bad really, it's just a very, very faint sort of pink. So it looks like it's healed very well. But yeah, we'll abbreviate on that a bit more later on. So, if we start off with the eyes, first of all, if that's okay with you, that's great. So first I'm just going to have a look inside your eyes, you know, just to check for signs of little blotches perhaps, or discoloration in the eyes. So I've got my trusty little torch here. It's not very strong, it's not a strong light like most opticians would use. This is a sort of ultraviolet sort of medical light, I suppose you could use that term. And it's, I find, a lot more effective, and it's a lot less strong for your vision. So, no, you don't have to get up. I'll kneel down because I just want you to stay there and relax. Okay. So, if I just have a look at your eyes firstly. So, okay, that's great. If you could look up for me, sort of like this. Great, thank you. Okay, that looks fine. And to the left. That's great. The right, please. And if you could look down for me as well. That's great. Okay, excellent. Okay, right, so I'm going to have a look in there now. Like I said, it's not going to hurt. It's just going to be very sort of blue. Okay, so if we start off with the left eye. So if you could look up for me again. That's great. And to the left. That's fantastic. And to the right, please. Oh. That's fab. And if you could look up for me as well. That's great. Okay. If you could just look down again for me one more time. Okay. That is great. Okay. So if we do the right now, this pretty much could be the same thing as what I just did with you. Okay, so if you could look up for me. That's great. Down, please. This torch really needs charging, but never mind. Okay, to the left, please. That's great. And to the right. Great. If you could just look just straight at me now. That Brilliant job. Okay. Okay, you can rest your eyes now. Ooh. Okay, so we're done with that part of the exam. Just gonna quickly write the report. There's nothing to worry about really. Your overall eye health is very nice. Don't see any discoloration, any blotches, any bloodshotness at all, or anything like that. So your overall eye health is great. Okay, so if we move on next to the eye chart. Sorry, I've got a squeaky chair. But yeah. Excuse me for a moment there. Okay, so I'm just going to point out a few things on the eye chart. If you could read it for me, that would be great. Okay, so if we start off with the top letter here, if you could read that one for me. E, yeah, that's great, brilliant. If you could read the second line. So, yeah. And P, yeah, that's great. This is getting a little too easy for you. Which line do you think you could find the most difficult? So, would you say 8 or 7 perhaps? You'd say 7, okay. So if you wanted to try line 6, yeah? Okay, great. So yeah, D, yeah. C, Z, P. Okay, that's great. Did you want to have an attempt at line 7 at all? It's completely up to you if you want to try. Okay. So, it's this line right here. Okay, so start with this one. Okay. Yep. Alright. Yep. And the last one here. Okay. That's great. Okay, so if you'd like to cover your left eye for me. Yeah, just like that. Okay, brilliant. Apologies. Again, which line would you think would be the one that would be the maximum that you could read? About 6 again. Okay. Did you just want to read it out again? Okay. So E, D, C, Z, and P. Okay, that's great. And if you want to cover your right eye now, please. Thanks. Again, which line would you think would be the maximum that you could read? Okay. Okay, 5. Okay, well that's interesting. Okay, so if you wanted to read that one for me. Okay, so we'll start off with this one. And E, yeah, C, yeah, F, great. And D. Okay, that's great. Okay, you can rest your hands now. No, it doesn't matter particularly if one eye is weaker than the other. That's very normal. But like I said, that's what prescription lenses will be for, to support both your eyes in sight. So, but no, that's very good. happy with the results of that? Excuse me, I've got a very sore throat. Okay, so now we've done that one, I think we should do the sense of feeling on your face area. Okay, so like I did before, I'm just going to kneel down and get a little closer. Basically what I've got here, I've got this brush. It's a very, very light brush, you know, so it's not going to be a very dull sort of feeling. It's going to be quite a soft sensation actually. So, but yeah, basically I'm just going to apply this at certain areas of your face, and I want you to see if you can feel it, and just, you know, let me know. It's not too ticklish, so it should be fine. It should be quite pleasant for you actually. So if you want to get started. Okay, so I'm just going to start off with the forehead area, because I'm just going to evaluate all your face, okay, just to finalise that it's certain areas. Okay, right, so if we start off with the forehead up here. How does that feel? If you can feel anything? You can? Okay, that's great. So if we move along a bit more here. Right, to the hairline. Is everything normal? That is great. That's excellent. Okay. Alright, so we're going to move along now to the eye area, I suppose you could call it. So just this, around this area here, under your eyebrow, but just above the middle of your nose, okay? So if we start off with under the eyes like this, okay? Sorry, this throat. Okay, so how's that? Can you feel that? Okay, that is great. Okay, we'll just do the other side. Is that about the same level of feeling on both sides? So, one side, the other side. Okay, great. That's excellent. Bloody pop-up ads. Okay, so, right, we're going to move on to the cheek areas now. So, I'm going to do it lightly, because we're going to do it in different strengths, okay? So we're going to do it lightly, like this, first of all, and then I'm going to press a little harder, but it's not going to hurt, okay? So if we start off this side, so I'm just going to lightly brush your cheek, okay? Just like that. Okay, how's that? Can you feel anything from that? Okay, no, that's fine, don't worry about it. If we move on to the other cheek, we'll see what happens there. Okay? So, what about that? Anything? Slightly. Okay. Well, that's a good result. Okay, so if I push the strength up a little bit more now, so if I just push it a little bit harder, Perhaps with the tip actually I may just dot you around like this. Okay? So we start off with the one that you actually had feeling in, so if it may improve a lot more, like this. How's that? Yeah? Okay, that's great. Brilliant. Okay, so if we move on to the other cheek. Right, ready? So, anything from this side or not? Slightly. Wow, that is good. That is great, actually. So, it's great to know you haven't actually lost any sensation in any parts of your cheek areas. At least, I just think that side of the cheek will just probably need a bit more time to repair, so it can feel light touches, like I did previously. But no, that's great that you can feel them both. It's just one side needs a bit more force than the other, that's all. Okay. That is great. So I'm just going to write this in to your doctor, and that will probably be sent in about half an hour, because I don't know about you, but I am starving, so I'm going to go on my lunch now, I think. Yeah, but no, that's pretty much it. We will continue it another time if your doctor wants you to continue doing these. And of course, if you want to continue doing them, that's absolutely fine. If you just call up the receptionist down the hall, they'll leave their number for you if you ask for it. Or we could actually email it to you now if you'd like, if you want me to pull it up for you. Yes, that's great, okay. So if I could just get your email, because it's not included in the doctor's note. Yeah, I'll just send it you from my personal email. I wouldn't tell if you won't. Okay. I'm ready if you are. Okay. I'll just put the subject matter under Dr. Terrence office. And I'll just put the number below. Obviously I'm not here all the time, so I will quickly just write down what days that I know I will be in for the next month or so, because we have monthly rotas here. So I am usually in I'm usually in on a Monday morning, Tuesday morning, Wednesday afternoon, Thursdays off, Friday morning, Saturday morning, Sundays off. Okay. So that is it. I'll just send that to you now. Okay, great. Okay, so that's all done. So how did you get on with this examination then? Yeah, like I said, it's very, very easy, it's very relaxed. So yeah, I'm very happy with today's results. I mean, I don't see anything that's a problem. I mean, with your face area again, it sounds to me, and the results show that, they're coming back, the sensations of feeling on your face. so you know that is positive. So yeah, thank you very much for coming in. Yeah, okay, yeah, and I'll see you out. Alright.